When they say the word brain tumors, there are usually the tumors which are occurring inside the brain or which can spread into the brain from outside the brain. Good day everyone, I am Dr. Srinath, consultant neurosurgeon at Renova Hospitals, Kompally. Today I am in front of you to talk on the topic of the brain tumor. So primarily the brain tumors are divided into malignant and benign types. Most commonly we encounter tumors which are benign of type. The lesser fraction of the brain tumors are malignant or cancerous in type. So when we come to the benign tumors which are most commonly encountered, the most common type of benign tumor is meningioma, which starts from the covering layers of the brain and usually has a very long duration of growth and can be successfully removed depending on the location of the tumor. The other benign tumors of the brain which are commonly encountered are the pituitary adenomas or the bony tumors or the choroid plexus tumors, which can be sometimes seen inside the brain. So when we see the benign tumors, the surgical approach is most important depending on the location of the tumor, and the result also is dictated by the location of the tumor. In easily accessible locations, most of the benign tumor surgeries are uneventful and the patient recovers near normal condition. In locations which are inaccessible, such as deeply situated or centrally situated locations, usually partial removal followed by further treatment of chemo or radiation therapy depending on the biopsy report is advised. If the removal is near total, usually benign tumors don't recur and can be regularly followed up with MRIs and further decision making. So in benign tumors, the various approaches can be a transcranial approach, or the skull is opened from outside and the tumor is removed through the brain or around the spaces around the brain. So in these tumors, usually the recovery is depending on the extensive of the tumor, the size of the tumor, the duration of the surgery, and the preoperative condition of the patient. If the patient has already been having any weakness of the part of the body or any speech difficulty or having any symptoms such as seizures, usually the recovery period will be prolonged. In other tumors such as the malignant tumors, these are fast growing tumors with a history of complaints of less than 3 to 4 months. Usually the commonest type of tumor we encountered is a glioma or a glioblastoma, which is usually having 4 grades, the grade 3 and 4 being called malignant type of gliomas. These gliomas usually occur late in the life period or very early in the life period in the young people less than 10 years, which usually are high grade and usually apart from surgery, depending on the location, medical oncology or radiation oncology advice. So most of the glioblastomas which need to be removed have to be removed as totally as possible to decrease the chances of recurrence or increase the success rate of the medical oncology and surgical radiation oncology. So if the patient has a regular follow-up after surgery with regular medication as advised by the neurosurgeon or oncologist, most of the patients usually have an uneventful life and may require rehabilitation in their as part of the treatment. Thank you.